Can you draw a butterfly, please?
Sarah Grainer has been a foster carer for children in state care for more than 2 decades.
That's it. It's a butterfly dot to dot.
It's a constant juggle for Sarah, who often has multiple foster children in her care at once. Currently, she has just one, a 7-year-old with complex needs.
Well, there's quite a few rewarding elements to being a foster carer, but I've got to say, seeing a child believe in themselves, know that they can take on anything they want to do, is a really special privilege to be part of.
Sudden changes can impact her foster son. A few months ago, a child was abruptly transitioned out and communication was cut off. Sarah says she warned the Department of Child Safety that this would cause distress to the boy who remained.
Sorry. That was a really sad period of time for us to go through and experience. He became excessively violent. He was harming himself. He smashed his bedroom window with his head. The lack of support and understanding from the staff involved with the department meant that we had to ultimately say we will not work with that service centre again.
The Department of Child Safety says changes to a child's care arrangements should be planned and supported. And carers are encouraged to raise concerns directly with the department's complaints mechanisms. A litany of systemic failures has plagued Queensland's child protection system for years, including abuse in residential care and deaths of children. The Queensland Government has launched a wide-ranging commission of inquiry to investigate and take submissions.
We are determined to get to the bottom of a broken system, and we are determined to make sure that we can help vulnerable kids and do all we can to ensure that community safety is put front and centre in this state.
The inquiry's public hearings kicked off in Cairns last week. Foster carer Gail McLaren, who is also a registered nurse, told the Commission that the Department of Child Safety wouldn't pay for private treatment for a child who needed immediate medical help.
When my child first came into care, they had terrible skin. They had scabies and needed to be treated because obviously scabies is highly contagious, and if we bring that child into our home, we're going to get it too.
Ms McLaren told the Commission that the department said to put the child, who also had a staph infection, on a public hospital wait list. She decided to pay for the private treatment herself.
And that child could have died, really, potentially. If they've got staph and their immune system's really low to begin with, and rheumatic heart disease, and it's not funny.
Foster carer Camille Batossi told the Commission there was a lack of support while looking after children with complex needs who can be violent.
I had a child who had a massive breakdown. He smashed all the windows in my house. He stabbed my husband. Yes, with a pair of scissors. Yes, we are threatened every day when we get children like that in your house.
Another carer described how her foster daughter, who had a cognitive disability, would become violent after weekly unsupervised visits with her biological mother. The carer told the Commission that she needed more support, and the child was ultimately moved into a residential care facility.
And all she did for a year and a half was run away to our house. I would come out every time something happened and she would be sitting on our curb crying. Can I come home? Can I come home?
What were you able to say to that request?
All I could say, I just had to give her a hug. I would sit with her until the support workers came to pick her up, and just reminded her that she didn't leave because she was bad. She left because she needed more than we could give, and things were too difficult in terms of systems around her. She did not deserve that.
New figures show that when some kids run away from their placements, the department loses track of them altogether. A Queensland government audit in July found 772 children were missing from care. 594 of those have a diagnosed or suspected disability or mental health disorder. 51 were on bail, and 81 children were subject to a youth justice order. 27 were under the age of 12. All of the 772 children have since been found.
They were returning to their family home where they may have been removed because it is too unsafe to be there. That poses a risk to that child and potentially a risk to community. But what we also uncovered was children sleeping rough.
The department will know where the kids are for a period of time, then the kids will disappear and move on to somewhere else. But they knew that they were in circumstances where they were unsafe, where there was drug use, violence, crime. So really, really awful circumstances for kids 16 and under.
The Youth Advocacy Centre works with kids in the youth justice and child protection systems.
This is a horrific failing on child safety's part because we have a generation of young kids who aren't going to receive the support that they need to flourish.
The Commission of Inquiry will continue in Cairns for another week and a half before holding public hearings around the state. Foster carers like Sarah Grainer say it's an opportunity to finally be heard.
If you want to achieve something for a child in the right support context, then you need to know about that child's life and the people they live with. I think we need to get better. Our whole system needs to get better at helping our children.